Measles outbreak in West Texas. What you need to know. Silent threat is spreading. Are you at risk? Imagine walking into a grocery store, a school, or a church, completely unaware that an invisible, highly contagious virus is in the air.
Within minutes, you could be exposed.
This is the reality for communities in West Texas and eastern New Mexico, where a measles outbreak has exploded to 90 cases across 7 counties, with 16 hospitalizations.
Measles, a disease that was nearly eradicated in the U.S., is making a dangerous comeback, and it's hitting the unvaccinated the hardest. How did we get here?
Why is this outbreak happening? And most importantly, how can you protect yourself and your family?
Let's break it down.
Where is measles spreading? The heart of the outbreak. The outbreak is centered in rural West Texas, with cases rapidly spreading across multiple counties.
1.
Gaines County, 57 cases. 2. Terry County, 20 cases. 3. Dawson County, 6 cases newly reported. 4. Yoakum County, 4 cases. 5. Lubbock, Lynn, and Ector counties, 1 case each. New Mexico is also seeing cases, with 9 reported in Lee County, right on the Texas border.
Public health officials are concerned about high exposure risks in everyday places like hospitals, grocery stores, churches, schools. Measles isn't just a mild childhood illness, it's a serious, life-threatening disease.
Why is this outbreak so severe? You might be wondering, why is measles spreading so fast? The answer? Low vaccination rates. Many cases are concentrated in a close-knit, under-vaccinated Mennonite community, according to health officials. The majority of infections are in children. 1. 26 cases in kids under 4 years old. 2. 51 cases in kids aged 5 to 17. 3. Only 10 cases in adults. In Gaines County, nearly 14% of school-aged children opted out of at least one required vaccine in the 2023-24 school year, one of the highest rates of vaccine refusal in Texas. Nationwide, childhood vaccination rates have dropped since the pandemic, increasing the risk of outbreaks like this one. Measles thrives in communities with low vaccination rates, putting both kids and adults in danger. What is measles?
The danger of a forgotten disease. Measles isn't just a harmless rash. It's a highly contagious and deadly virus. How contagious is it?
1. The virus spreads through the air and can linger for up to 2 hours after an infected person coughs or sneezes. 2. If 10 unvaccinated people are exposed, 9 of them will get sick.
Complications can be severe, especially for young children. 1. Pneumonia, leading cause of measles-related deaths.
2. Brain swelling, encephalitis, which can cause permanent brain damage. 3. Blindness. 4. Miscarriage and birth defects in pregnant women. There is no cure for measles. The only real protection is prevention, which brings us to the MMR vaccine. Is the measles vaccine safe? The truth behind the MMR shot, short answer? Yes. The measles, mumps, and rubella MMR vaccine is safe, highly effective, 97% protection with both doses, required for school entry in most states. The recommended schedule for kids: 1. First dose at 12-15 months old. 2. Second dose at 4-6 years old. Does the vaccine cause autism? No. This myth started from a now debunked study, but decades of research confirm there is absolutely no link. Before the vaccine, 1963, 1. The U.S. saw 3 to 4 million cases per year. 2. 400-500 deaths annually. 3. 50,000 plus hospitalizations. Today, 1. Fewer than 200 cases per year in a normal year. Measles outbreaks only happen when vaccination rates drop. Getting vaccinated isn't just about protecting yourself, it protects the entire community. How to protect yourself and stop the spread, health officials are taking action. But you play a role too. Get vaccinated. If you or your child haven't had both doses of the MMR vaccine, now is the time. Check exposure sites. If you've been in Gaines or Lee County, be aware of symptoms. Stay home if you're sick. Measles spreads before symptoms appear, so avoid exposing others. Seek medical care if needed. Complications can be life-threatening, especially for young kids. Who's most at risk? Babies under 1, too young for the vaccine. Pregnant women, risk of miscarriage and birth defects.
immunocompromised individuals, cancer patients, transplant recipients. Free vaccine clinics are being held in affected areas. If you're in Texas or New Mexico, check with local health departments. When vaccination rates are high, outbreaks don't happen. Protect yourself, your kids, and your community. This shouldn't be happening. Let's stop it together. Measles was almost wiped out in the U.S., but because of falling vaccination rates, it's back. This isn't just a Texas problem or a New Mexico problem, it's a warning sign for the entire country. We have a choice. Choose protection. Choose facts over fear. Choose science over misinformation. What do you think? Are vaccine exemptions making communities less safe? Do schools need stricter vaccine policies? Drop your thoughts in the comments. Like and subscribe for more health updates. Share this to spread awareness. Your friends and family need to know. Let's fight misinformation and keep our communities safe. Measles belongs in the past, not in our present.